Morning. Come on, you can do better that morning. It's a real honour for me to be here, and I mean that. I met Glenn a few months back, and I was really impressed with Glenn. We were sitting in a room full of really good people, but Glenn had this ability to cut through. And when he started speaking, your ears went up because he cut through the funnel and started talking. And he asked me, Ashley, could you come and address this audience today? And I thought about it for a while, and I thought, what have I got to offer? GS1, a process-driven standardisation sort of organisation, and what have I got to offer? And so, but he said, you've got to do it, and so here I am. And so I really thought about what I could offer you today. And also, it's a privilege for me to be in Loughborough, because as I was driving up from sunny Essex last night, my father informed me this is where he was evacuated during the war, and he had a lovely time, so thank you very much, Loughborough, from my dad. National Patient Champion. It sounds fancy, but I'm always the one, Duncan, sitting around a table without an OBE, without the sir, without the dame, without that, and I'm just the bloke from Essex in the corner that has just been invited. And the Essex drawl, do you need a translator, or can you understand me? Sometimes, yeah. No, I don't watch Towie, and I don't know Joey Essex, because I get asked all the time. Okay, so I'm going to be talking to you about my interpretation of what standardisation means in practice in culture change. And I'm going to tell you why I'm interested in that and why I work in it. The National Patient Champion title is a little bit misleading. I don't really work with patients that much anymore. I've been doing it quite a long time. 95% of my time I'm working with NHS organisations. And that could be acute settings, that could be mental health, that could be CCGs, that could be national programmes of work. And I found myself in there because I've got a certain view on this, based from experience. The standardisation in me is no matter what I do, where I am, who I'm in front of, and basically my given week I could be in front of 200-ish people a week, NHS employees, around the country, up to 1,000. Every time I speak, do a workshop, facilitate, or be involved, I revert back to the NHS Constitution, which is our standard culture in the NHS. The reason why I mention it to you today is that I predominantly work in organisational development culture change now. That's what I do, if you like. But the 1,000 people a week that I'm in front of, I show them this document, and I'm lucky if 2% of the audience know the document exists. 2% of the audience know it exists, and they work in the NHS. 1.2 million people-ish on a given day involved in the NHS. That could be pharmacists. You work in payroll, you keep our estates clean, you could be a nurse, a consultant, you could be a GP, a dentist, you could be a delivery driver, you could be whatever in the NHS. You should be adhering to the NHS Constitution. It's a legal document, went through Parliament. Second most important document you should know about if you work in the NHS. The first is your contract of employment, the second is the NHS Constitution. Clearly tells you, 16 pages of easily read instructions, pledges, aims, objectives of what we're meant to be doing here and how we're meant to be doing it. But yet 2% of people I meet know that it exists. So the standardisation of this simple document isn't even in the NHS. The reason why I mention it is because of this one paragraph, and as many of you might know, have heard me, I don't know, I read it every time that I speak. Because it absolutely sums up the reason why we're here, and I think it absolutely sums up why GS1 need to be involved, because you need to help save our NHS by any means necessary. And if that's standardisation of products so we can be more efficient and make cost savings so we can reinvest that in the NHS, exactly, we need to be having that conversation right now, today. The NHS belongs to us all. The NHS belongs to the people. It is there to improve our health and well-being, supporting us to keep mentally and physically well, to get better when we are ill and when we cannot fully recover. To stay as well as we can to the end of our lives. It works at the limits of science, bringing the highest levels of human knowledge and skill to save lives and improve health. The last sentence is me. It touches our lives at times of basic human need when care and compassion are what matters most. Poetry. But yet 2% of the 1.2 million people know about it. If we're going to have standardisation in the NHS, I believe It starts with us. It starts with standardisation of culture. Because we could have the best processes in system, but if people don't want to do it, people go, I don't want to do that, I'm going to buck the trend, I don't want to do it, I'm anti-GS1, all of that, it's not going to happen. It's not going to have its full potential. So being patient champion, the whys, the lows and the highs of what I've been doing, trying to standardise care in the NHS. So I show this picture a lot. It's the only picture I've got from when I was ill. 13 years ago, I had leukemia, AML3, acute myeloid lymphoma 3. I was a very sick man. I got blue lighted into Bart's Hospital, spent 7 months under Bart's Hospital's care. I received world-class care. I received world-class care. The best the NHS can be, I got it for 7 months every day. And this is a picture of my son being 30 seconds old, just been born. He was given to us by Bart's Hospital via IVF. That's where the NHS works, just there. But all my care wasn't so good elsewhere. So the reason why I'm here today is to talk to you about that thought process I had when I nearly died. So all of my care, all of it at Bart's Hospital was world class. I had 4 or 5 days in a general hospital near me, where I lived, a general hospital, and the care wasn't anywhere near world class. So much so, I was given MRSA inside my Hickman line, and I almost died. I went into a coma, almost died. When I recovered from that, it took a time. I got blue lighted back to Bart's, and they cared for me and brought me back to life, and here I am. But what I couldn't figure out then, in my process-driven brain, is why is the standard of care here so excellent? 40 miles down the road, it's completely the opposite. Why is that? I thought the NHS was meant to be the same wherever you go. Free at point of care, the same wherever you go. And that was a big lesson for me in thinking, that's not right, is it? The buildings are basically the same. The beds are basically the same. The wards are basically the same. The drugs are basically the same. Everything's basically the same, except for the staff. They're different. They're different. That's the only thing it can be. Of why that care out there was perfect, that wasn't. It nearly killed me. And if you put that into finances, Bart's at the time, spent £500,000 on my care, the chemotherapy, the radiotherapy, £500,000. A few seconds of bad practice, but someone not washing their hands properly, gave me MRSA, a few seconds, almost eradicated £500,000. Something not right there. Something not right there. So I'm going to talk to you about culture change. So I thought I need to do something about this. No one asked me. I thought I need to do something about this. I love the NHS in everything I do and say. It saved my life and gave me my son. How can I not love it? And I need to help. The trigger for me was that episode of MRSA. The trigger for me was nearly dying from something that was avoidable. The trigger. So, some people have said that I'm like him. He's a car salesman, they say about me. In a derogatory way, I might add. But Del Boy, you know what? He had aspirations above his quarter, didn't he? But he had a good heart. But trigger. What's the trigger of making people want to do it? Why should we want to do what GS1 explained to us that we need to be doing? Why should we do it? We're the NHS. They're outsiders, different organisation. They'll make money from us. What's the trigger here? Why should we do it? You've got to look at the trigger of making things and people happen and do things. The trigger. So for me, it was MRSA. I knew I wanted to help the NHS. No one asked me. I knew I wanted to help the NHS and give back and say thank you. So I created a hands hygiene campaign, because hands hygiene was ultimately the thing that nearly killed me. Not leukemia, dirty hands. And so I created a hands hygiene campaign based around a character called Max. It went really well. That was in Great Ormond Street. That was in the little school in Great Ormond Street. The little baby I was holding, there he is there. He came with me that day. And I knew if I wanted to change things in the NHS, it's not to stand outside pointing at you saying how rubbish you are, my service was terrible, you nearly killed me, throwing stones, was to come in and love you. Come in and love you like you showed me love. And I knew that would work. Passer, Duncan, asked me to go down to Southampton Hospital, said, all right, Ashley, prove it works. So one man against 6,500 staff at Southampton Hospital, I was asked by the Department of Health and PASA to go down there and change culture. I literally had to go to WH Smith's and get a dummies book on how to change culture, and off I trotted. And I went and moved down there for 3 months, and we put that campaign, or I put that campaign, into Southampton Hospital. And the imperative from the DH at the time was, don't involve patients, this must only be directed at staff. At staff. It was hard work. If you're going to lead from the front, you've got to be prepared to do all the dirty work as well. And I had to dress up in that suit, and it was hot in there. I don't just like wearing tights, you know. But you have to get involved. You have to show people you mean it. And I went down there and I changed culture of 6,500 people on my own because I had passion to do it. And I know you like a bit of data and research, I know that. So that's where Southampton was before I was there. That's the day I started. 3 months later is the day I left. Because that was the trigger. The trigger for me was explaining to people, some of the rudest people I've ever met in my life, by the way, some of the rudest individuals, where has people's manners gone? Where has people's politeness gone? To say, all I want you to do is take your watch off, wash your hands before you touch me so you don't kill me. And that was the trigger in people that got them. So yeah, I can see what you mean now. So it can be done. We need to standardise this stuff. We need to standardise the care in every single episode of care in the NHS. You know the figures. Every 36 hours, 1 million people get seen by the NHS. And it's all varied. It's all varied. I'm pretty stupid. I was trying to find John Wayne, a picture of John Wayne with a trigger. I'm pretty stupid. I naturally thought when I came and started working with the NHS that everyone was going to be lovely. I thought everyone was going to be nice to me because I'm a patient. I was wrong. I quickly found out that I'm definitely on the outside. And trying to get in has been harder. Trying to work with the NHS has been more difficult than recovering from leukemia. Because people don't want you to come in and say, can I help? What about if we try it this way? But the trigger for me, when I have those bad days, and trust me, I had one yesterday. I didn't sleep last night because of the way I was treated yesterday. It's apparent in my life from an NHS manager. And when it gets hard, because trying to standardise people, trying to get people to do the same thing together consistently is a hard job. And anyone in here that says it's easy, please tell me how to do it, because I find it difficult every day trying to get people to do the same thing together. But I look at my family as my wife and my youngest. I go back and think, you know what, I want an NHS for them. I want my NHS that I love so dearly to be there in 20, 30, 40 years' time. I don't want it to be privatised, really, if I'm honest. Or if it is privatised, that we work together in partnership and no one's frightened of it, Sam. I want to make sure that when my children have children, that they've got that asset in their life called the NHS. And when it gets hard, I think of my son, the baby in my arms. 13 years later, I think, you know, he wants to become an oncologist. How amazing would that be? And I think, no matter what a bad day I had yesterday, the future of the NHS is not in our hands today, it's in their hands. And I go back to my past. Bless her, my lovely mum. That was her in 1958. NHS was just 10 years old then. There was a different attitude of the NHS in 1958. Proudest day of her life. I've been around nursing all of my life. Proudest day of her life was when she became a registered nurse at the North Middlesex Hospital on that day. We're all proud of the NHS. We just need to talk about it more. We need to show it more. And we need to absolutely capture passion. Like, you know, this whole thing is about passion. We can do things better. We can, look, it says there, we can save lives and save millions of pounds. We want to save millions of pounds, don't we? And we want to save lives. But why can't we get back to a situation in this country where we absolutely look at the NHS as what it is? It's our second mother, isn't it? The one we turn to when we fall over. And the team that looked after me, Bodley Scott 3, 13 years ago. All these nurses. There was more, obviously, but these people were so dear to me. These are the people that saved my life and got me better. So when it gets hard about standardisation, about trying to get people to do the right thing consistently, and I think, I'm going to throw the towel on this, there's got to be easier jobs. There's got to be easier jobs. You know, I took this role not to be spoken to like that. I think about them. No, I've got to keep going for them. I've got to keep going for the people that absolutely dedicate their life and soul to the betterment of the NHS and caring for people. Because there's millions out there that do that. Let's be proud of who we are and what we do. What does that mean? So, pride, culture change. I've been involved in 2 of the largest culture change programs in the NHS today. So I work at an organisation called BHRUT, Barking, Havering, Redbridge University Trusts. That's King's and King George's down in Ilford and Romford in Essex. And I was asked to go there by the Chief Nurse of London, Caroline Alexander, because they've had issues and they've had challenges, still have and still will, at the foreseeable time. We're working through it. But this culture change was based on that, was based on people not being proud to work there. That was the trigger. That was the trigger down there. It wasn't an overcrowded A&E. It wasn't a new directive from the Department of Health. It wasn't that the commissioners wanted a different way of doing things. It was people, 6,500 of them there, not being very proud of their organisation. And if you're not very proud of the organisation you work for, you're not going to do your best. You've got to do enough. And so we started to look at that. Why aren't you proud? What do we need to change to standardise everyone here so it's consistent? And we started talking about the big things that we do. Do you know the NHS? Defined by its problems, never by its achievements. Why is that? So we started talking about the achievements of the organisation, the 1.2 million people that are seen there every year, the 8,500 babies that are born there every year, the advances in stroke care, Centre of Excellence, the advances in cancer care, Centre of Excellence, and so on and so on. And the audience, the staff who come through the workshops, started to act like peacocks. And rightly so. Rightly so. But it needed a trigger. It needed someone to say, hands up who's proud to work here at the beginning. Maybe 1 or 2 people did out of an audience of 100. And then when we finished a workshop, hands up who's proud to work here now, you'd have 95% of people put their hands up because they suddenly realised what an asset they are to that community down there. And what they do is valued by society. Standardisation, culture change, getting everybody to believe in themselves, and it can be done. It can be done. Do you remember him? Who remembers him? Who is he? Gripper. You've got to be a certain age. Gripper Stebson. So you've got to be a certain age. For those of you around 50, you might have watched a programme called Grange Hill. That was Gripper Stebson. He was the school bully. Kept me awake at night thinking, going into secondary school, I was going to be bullied and my head was going to go down the toilet the day I got there because of Gripper. But this was another trigger. This was a huge trigger down at Bart's Health. The trigger was for culture change down there that their culture at Bart's Health was described as bullying. Bullying Bart's, it's called. We can't take that lightly. I work with the people down at Bart's Health. Across that's the organisations down there, 15,000 people. And time again, day in, day in, you hear episodes of bullying, harassment that shouldn't be allowed in NHS organisations. But nonetheless, they are. Someone's allowed it to happen. And so you've got to try and unpick that. And the trigger is having open and honest conversations about it and saying, why are you allowing, to the leadership, why are you allowing people to be bullied? Why are you allowing yourself to be bullied? It says changing lives because it's different from BHRUT. There's not so much bullying and harassment down there, it's just making people proud of what they do. At Bart's at the moment, we're trying to change people's lives, and we're talking about the staff, trying to change their lives into an organisation that they want to come to work in, that they feel joyous, that they want to do their best, that they don't feel bullied and harassed. You come along with GS1 and say, yeah, we're going to put this product thing in place today, it wouldn't work there today. It might work in a year's time because the staff maybe feel better about it. The culture change down there is shifting, it's getting better, but there's work to do. But you've got to get the trigger, you've got to say to people, this is why we're doing it. We know you've been bullied. We've bullied you. We're going to stop it together. The trigger. You've got to find out the root problem. And you've got to be open and honest about it. If you're not open and honest about it, no one's going to believe you, no one's going to follow you, no one's going to do anything. If I tell you how you feel, you'll most probably come with me. About this one. Money. I'm fortunate enough to work with something called Future Focused Finance. My colleague Sam's here. She's going to be talking about it a lot more later. I'm not going to steal her thunder. But 15,000 of the culture change program again. Let's start with the people first. Let's get them on board. Let's see what we can do together before we talk about any strategies. 15,000 people in the NHS working finance have come together and said, right, let's try and do something differently together in the future. What do we need to do? Let's involve people. Let's involve patients in this. And so we have. We've travelled the country. We've been to Manchester, Liverpool, Coventry, Devon, London. And we've spoke to patients and public of the NHS to find out what knowledge they've got of finances and if they're interested. There is no knowledge of finance, and they are very interested. We ask simple questions. Explain the NHS finances very simply so people could understand what we're talking about. I'm not going to steal Sam's thunder, but just one piece of information from these groups. We asked a simple question: how much money a year do we spend on the NHS? I'm not going to ask you that question today, but it ranged from £1.5 million a year to 5 trillion. Doesn't that tell you something? We need to standardise the messages that are going out there. We need to work together and make sure people understand together consistently that this is what we're dealing with. Because all of the audiences across the country that we've explained to want to know more, want to be involved more of how that money's spent. It's a culture change programme, a standardisation programme. And lastly, this one. I was on holiday a few weeks back, and I was talking to an American chap. And he worked in a pharmaceutical company in Texas. He said, "What do you do, Ashley?" And I said, "I absorb other people's negativity for a living." So that isn't a picture of me, by the way. But that's what I do. On a daily basis, to give the passion that I've got to you, I've got to take away your negativity and fill you with passion. But I'm talking about something else here. We've created a situation in our NHS. We've created a situation in our NHS where people are frightened to speak up. Where people are frightened to speak up about what the problems are. What the problems are. We might have people in our procurement department saying, "Do you know, why don't we standardise things?" But they're frightened to speak up. You're going to be a breath of fresh air to a lot of those people. But I'm talking about on the ground, staff working, hard working staff in offices, in departments, 12-hour shifts, who feel that they can't speak up. So I've pioneered something called the Guardian Service. It's 2.5 years old now, it's really successful. And 9 out of 10 people who come to see me at the Guardian Service, completely confidentially, just sit there and tell how they just not heard, not listened to. They're being bullied, they're being harassed, they're being poked and prodded. The pressure's too much, no one's listening to them. They're getting more and more work, less and less funding. And so If we're going to ask people to look into standardisation, we have to have those staff on board. All of those procurement and finance staff are going to want and need to do it, not just be telling them to do it again. The staff of the NHS, you know, some of our most valued people in society who look after the most vulnerable people in our society, need to be listened to. The standardisation of that needs to be across the NHS, doesn't it? Everybody I come across in the Guardian service, I ask them this question: why are you using the Guardian service? Number one reason is fear of reprisal. If I say something's wrong, I'm going to get sacked, or worse, or nobody ever listens to me. And so we do need to save money. This is fantastic. This ambition here to save thousands of lives and millions of pounds by simple barcoding products is a simply good idea. And I'm all for it, advocate of it. But I'm also an advocate for the people who work in the NHS as well. This is a people business. We're not Morrison's. We can learn lessons from them. We're not Morrison's. We don't sell veg and Coca-Cola. We deal with people's lives. And the only standard that we need to really worry about as we go through our journey and evolution of the NHS is how we affect those people's lives. Our colleagues, our staff, our patients. And hand on heart, does anyone in this room think that we've got that right? This is really important, but let's not lose sight of what is the most important. And that's, we're only here, all of us, for the patients of the NHS. Thank you for listening.